All right, we are going live. So, Dr. Hizbay Ali,
Good to be back, Dr.
as
Mike.
promised, we are back Sunday, 2 p.m. Eastern Time.
Yep.
Have double board certified psychiatrist Dr. Hizbay Ali. And can you explain to our audience what you're double board certified in?
Yeah, sure. So I'm board certified in general psychiatry, and my subspecialty is psychosomatic medicine, also known as consultation liaison psychiatry.
Okay. So psychosomatic, that literally means mind body, right?
Yeah. Yes. Yes.
If you translate the Latin, it's mind body,
It's a mind body.
right?
Yeah. It's basically the capacity that psychiatrists kind of work in the consultation field is basically working with patients that are medically sick, a lot of them metabolically sick,
Yeah.
and we get consulted for when there's psychiatric symptoms or manifestation, behaviorally, emotional disturbance, things like that,
Yeah.
and come in, kind of like address the psychiatric component. For the longest time, there's a split between the mind and body,
Yeah.
right? And only now is it like, wow, like we know that there's that
Oh,
very
sorry. I
great
just have
dynamic
to.
interplay.
We're starting to see the comments in because we just went live for this. Sorry to interrupt, but we have John Zook, Sup G. We got Peter Parker. Hello, hello. I got Jay. Hi, my favorite doctors. Thank you, Jay. So yes, once again we have. Oh, volume is really low. You know what? Let me crank this up.
Yeah, let me jump this closer too.
Thank you for letting me know. By the way. All right. I think we're good there. How's the volume there? Huda. Hello, DW. Terry Roberts. Dream Home. I think the volume is better now. Much better, much better. Okay, fantastic. Thank you for letting me know. Appreciate you so much. Oh, now it's way too loud. Overcompensated. I appreciate you letting me know, guys. Really loud. Too close to the mic. Technology is not our specialty. I apologize. Okay. Great volume. Just a tad lower. Okay. You guys are awesome, by the way.
Turn it to 11.
You have to keep in mind, I'm a drummer, he's a guitarist, so our volume
Right.
levels are just way off.
We're partially deaf.
Okay. Sherry Prince says good. Thank you. Thank you so much. Much better. All right. Okay, great. Thank you. So yeah. So as we were saying, if you couldn't hear us, we'll just say everything again. So have Hizbay Ali here. He's a psychiatrist who's double board certified in general psychiatry as well as psychosomatic psychiatry.
Yep.
Can you explain what psychosomatic means?
Yeah, psychosomatic medicine, also consultation liaison, is basically the mental health aspect of a patient when they present. They have symptoms. It's medical, basically a medically ill patient, and we get consulted to come and evaluate for any emotional issues, anxiety, depression, dementia, delirium, basically any cognitive or emotional behavioral disturbances, perceptual disturbances that result either from medical, like a medical illness, or it could be that they have a comorbid psychiatric issue and complicating medical issues. So it becomes a complicated, complex case. So we approach it from the psychiatric aspect, but we work with a multidisciplinary team in terms of coordinating the care and the treatment. And so basically, yeah, it's working with the medical team.
Okay. Yeah, I'm just gonna
Yeah.
move the mic closer to you. So now this focus of this mental health topic is going to be anxiety, right? And anxiety is you can think of it as two types of general anxiety. There's what we call a true anxiety and a false anxiety.
Yeah.
Could you explain the difference between the two and what is the most common one,
Right.
90%?
Okay, so excellent question. Anxiety, I believe, is probably the most commonly reported subjective symptom, right, that a person feels, and probably around the world. Um, and anxiety is, really tricky. It has so many different, causes, associations, that could be the underlying reason for it. So a lot of people usually come in saying they're feeling anxious and they want treatment or help for the anxiety. It is helpful to probably differentiate it into true and false anxiety. And false anxiety is, again, anxiety. The anxiety is real. So I just want to clarify that. When the person's feeling anxious, not that one's true or false. It's what is the cause of the anxiety.
Right.
And we say false anxiety because it's more of a downstream effect. The anxiety is a result of an imbalance or maybe inflammatory state, metabolic state, or any other autoimmune disease, any medical thing that's happening.
Yeah.
And it's affecting your cognition, it's affecting your emotions, your limbic system, and inflammatory states that we're going to talk about. So the anxiety is more a result, is your body basically telling you something's wrong.
Okay. So we could think of it as the true anxiety as originating in the brain.
True anxiety is like, yeah, people that have, if they're metabolically healthy, there's no issue. Or even if you are, it's basically maybe you have cognitive distortions, right? It's more of a psychological phenomenon where your cognitive distortions. Again, people have anxiety is a spectrum ranging from just mild maybe anxiety related to stress because you had a new job or you're going through a difficult relationship or finances or whatnot. That's situational, right? And that's obviously very common. Everyone experiences that. Some people have general anxiety, and that's
So,
yeah,
because someone was mentioning general anxiety or unspecified anxiety,
right.
so we could have anxiety. So the general anxiety is basically okay. We have a bunch of stress in our life. Maybe our job is difficult. Maybe financial issues. Maybe relationship issues. These would all contribute towards a general anxiety, correct?
Yeah, generalized anxiety disorder is probably the most common, identified. It's a general anxiety when someone's feeling anxious from morning till evening and worrying about a whole host of things, not necessarily maybe one thing. It's worrying about, the finances of their job, they got a deadline, things of that nature. It's not necessarily.
I'm sorry. I guess yeah, just talking to the microphone.
Right.
I guess it's not loud enough. I apologize. I got to get this straightened out here. Um, let's see. Okay, I think we're good now. Let's try that. Go ahead and
Okay.
try that.
All right. Place the mic. Okay. Yeah, so getting back to anxiety, right? We want to differentiate between true and false anxiety. That's
Yeah.
that's that's one helpful way of at least delineating what is the
Hmm.
source, what is the cause of the anxiety, right?
Yeah.
Is it literally because you're having, psychological issues in terms of the anxiety is related to, maybe confrontation issues or, in your relationships, so you have unresolved conflicts or something like that. Yeah, that's like, you want to go to talk to a therapist and help you resolve those issues. Otherwise, you're going to be anxious, you know, in terms of like dealing with relationships and things like that. That's that's what I would call true anxiety. The rest of it, which I believe is most of us probably have false anxiety, which is we're not metabolically healthy, and that's our body telling our brain something's wrong, and we're in a constant state of like anxiety. A lot of it's poor sleep, poor diet, which we're going to talk about nutrition. Um, Poor sleep hygiene, all of these things contribute to your anxiety and your cognition the next morning,
Yeah.
right?
So, so we talk about the gut brain axis, right?
Right.
And we might be hearing about that, but a lot of people don't really know about it, and we just don't know exactly all the details about how that works. But
Right.
here's something that we do know, right? Is that you have a brain and you have the second brain, which is known as your enteric system, the nerves in your gut, right?
Right.
So your brain communicates directly with the enteric brain of your intestines,
Yep.
and it goes the other way around. So it's a two-way street, right? So your gut is talking to your brain is talking to your gut, and we think of the brain as mostly serotonin, right? It's
Right.
But we also have a bunch of serotonin in our gut.
Most of the serotonin is actually in the gut.
Isn't it about 95%
Something
of?
like that,
Yeah.
90%, something
Okay.
like that, right? So, yes, the enteric nervous system is also called the second brain, right? It has its own kind of nervous system that communicates with the brain, with the
Yeah.
central nervous system. And this is super important. This is super important in a lot of ways, because a lot of GABA and serotonin are produced from the gut flora
Right.
because of that. And so the healthy amounts of like bacteroides and lactobacillus, these are some of the gut flora that you want to have in healthy proportions. So your gut health is extremely important, and keeping that balance of serotonin and GABA, especially.
Yeah.
GABA I think is underrated. People talk about serotonin a lot, but those two both. And if there's an imbalance, then of course you're going to have fluctuating levels of serotonin. Maybe it's not enough.
Yeah.
GABA also, and you're going to be in a state of like anxiety and
Right.
not really know where it's coming from.
Yeah. So basically, what you eat has a huge impact on your anxiety.
Yes.
I mean, is that an overstatement or is it an understatement or is that kind of in the middle?
I would say that it's an understatement to
Okay.
say that like your gut, because we are just now appreciating, I think, the last 10 years or so, how important gut health is.
Right.
I mean, we all know that our gut health, modern society is not great, right? It's not great because of the processed foods and the imbalance of the microbiome, the diversity in our gut flora is probably, really suffering because we're not eating natural, real foods that have probiotics and
Yeah.
also are feeding the gut with enough fiber.
AKA prebiotics,
Yes.
fiber. So, okay, let's face it. Most people eat way too much processed food and not enough unprocessed food.
Yeah.
But I think there's a couple of problems with that. Is that one, people don't know what truly is processed and what is unprocessed. A loaf of bread in the bread aisle is processed. That wheat is processed grain. That wheat has been transformed from, originally it's in three parts, right? There's the bran, there's the endosperm, and then there's the germ. So it's three parts of that wheat. The bread that you buy on the grocery store shelf, 99% of it is processed, where it's you're just literally eating the flour, which comes from the endosperm.
Right.
So most people are eating mostly processed food. And the recommended amount of fiber that people should be getting, both insoluble and soluble fiber, is 30 grams per day. Most people come nowhere close to that. Most people are getting about 10 to 15 grams of fiber per day.
Right.
I think fiber is probably one of the most underrated nutrients that people aren't getting enough of.
Yeah.
And it has a huge impact on gut health, but also on how indirectly through this mechanism,
Yeah.
how indirectly it affects your brain health.
Absolutely. Yeah.
So to make the link between fiber and brain health, I don't think that should be underestimated.
No, absolutely not. And also, let's talk about leaky gut, right? Leaky gut is
Yeah,
because those bacteria are getting starved, the healthy bacteria that we need,
yeah,
right? Because we're not feeding them enough fiber.
yeah.
So when that happens, yeah, the tight junctions get kind of eaten away, right? I believe is that they like kind of feed off of that too because they're starving, basically.
Well, a lot of it is, so you could think of your gut bacteria as being either good or bad,
Right.
and you need to feed the good bacteria the stuff that they want to eat, which is fiber. They actually eat that fiber, the soluble fiber they eat, and the metabolite, the byproduct of that. One of them is called butyrate,
Yep.
and butyrate is it's a four carbon chain, short chain fatty acid. It gets absorbed into your bloodstream,
Yep.
and that has effect on your inflammation levels in the body. It actually impacts your brain, but also to your point, the leaky gut. So when you're not feeding the good bacteria what they want, guess what happens? The bad bacteria start taking over,
Yeah.
and now the bad bacteria, they start to eat away at the protective layer of your intestine, which is the mucin layer. So when those bad bacteria start eating away at that mucin layer, essentially what happens is you
Right.
can think of it as poking holes in the lining of your gut, and then things start to be absorbed into the bloodstream that shouldn't be absorbed
Yeah.
there. And then those antigens that are being absorbed in the bloodstream, now guess what?
Right.
Your body's gonna your immune system's gonna react to those
Exactly.
antigens.
There's endotoxins right in our gut.
Right.
They're fine staying in the gut,
Yeah.
right? But once they start leaking in, they cause an inflammatory reaction.
Not just inflammation in the gut, but inflammation throughout the body,
Yeah.
including your brain
Including your brain.
also is affected as well.
Yes, because again, like the communication between the enteric nervous system, it does communicate. It's a two-way traffic. Most of it is the vagus nerve collecting information and sending it really to the brain.
Yeah.
So, that's kind of what it is. And so yes, it's giving the brain a signal that something's up, something's wrong. You're in a state of infection.
Right.
So something's wrong. The anxiety is like your body telling you something's wrong.
Yeah.
That's kind of what it is.
And they talk to each other. The brain and the gut, they talk to each other.
Yeah.
So that's why if you're feeling nervous, that can affect your bowels.
Yeah.
That's why you get that weird
Butterflies-
feeling in your
butterflies
stomach,
in your
nausea,
stomach,
even
yeah.
diarrhea. Hence the term, I almost crap my pants.
Yeah.
It's because it's mental affecting the gut, right?
And that's one of the reasons why I know someone brought up side effects of SSRIs. I just want to touch on it. Yes, GI symptoms are a common side effect because, of course, the serotonin, you're blocking serotonin reuptake, you're boosting the serotonin levels. And, of course, like I said, the gut is where 80-90% of the serotonin is. So you're going to have some of those like queasy kind of feelings. They usually subside after a few days, generally, or a week or two. But yes, I mean that's one of the reasons why.
But also too, we talked about the brain affecting the gut, but also the gut has a huge communication to the brain where it's saying, okay, I just ate something, and then you start
Right.
maybe you're hearing your stomach making noises.
Yeah.
Maybe it's because you ate something that you shouldn't have eaten, some kind of processed food. Maybe it's a energy drink with all sorts of chemicals, artificial flavors, preservatives,
Yeah.
too much sugar, perhaps, trans fats, perhaps. So, highly processed food has a tendency to make our gut unhappy.
Yeah, yeah. I think it causes like a pro-inflammatory state
Right.
in general, and that affects not just obviously having systemic inflammation, cytokines. We know cytokines directly like affect the brain and cognition, but also the gut bacteria and the healthy diversity of it is very important and responsible for our immune system. Right, the
Yeah.
majority of our immune, development through childhood and whatnot happens because of this interplay of the gut flora and training our immune system,
Yeah.
which is why when they say like, yes, you've been exposed to a lot of stuff as a kid, then you do develop a healthier immune system. It's true, right?
Yeah.
But it's also, you have to have a healthy balance, which is why like, people that are on long-term antibiotics or things like that, that upsets the flora and they end up having serious issues. So, as we see with C. diff, for example, what
Right.
happens, with unhealthy microflora, then we end up having things like C. diff, which is very common.
Yeah.
Right. So the immune system is heavily influenced by the gut flora, and it kind of informs it. And I think that's why like having an unhealthy, gut diversity is probably one of the reasons why a lot of us have these, autoimmune, pro-inflammatory states. And how many people do we see on immunosuppressive medications? And again, when someone's having a flare up, someone has acute crisis, yes, those are necessary. But if you modify your diet and put your body in less of a pro-inflammatory state, you're kind of helping yourself,
Right.
right? You're helping yourself.
And of course, we're only talking about so far, we've only talked about one aspect of a lifestyle factor
Yeah.
that affects overall anxiety, right?
Yes.
So that's just what you eat is only one factor, right? So
Yeah.
so if you actually change what you ate to just unprocessed food, if you ate only unprocessed food, that in itself will have a huge impact on your overall anxiety levels. I think it's fair to
Yes.
say that.
It's
But we
hard
also
to,
know
yeah.
that but we also know that there's other things that you can
Yes,
do.
lifestyle, of course. I
So
mean,
so nutrition just one part of lifestyle. We know.
sleep is a huge part. Again, in this culture, this society, I don't know anyone that really gets like proper sleep. Also, social media, being on your
So the
phone or
recommended amount of
tablets.
sleep, the general recommendation,
Yeah.
obviously everyone's different, and I'm not going to get into people with mutations in certain genes who only need 5 hours of sleep. They're the exception, not the rule. So, in general, most people need 7 to 9 hours of sleep, and it's not
Yes.
just the quantity of sleep; it's the quality of sleep
Yeah, the
because
quality of sleep.
your brain needs to go through all the stages, REM and non-REM,
Yes.
in order to get its fully restorative properties, basically.
Yeah, we'll do a podcast just on sleep because it's such
Right.
a huge issue. But yeah, in a nutshell, you're right. Sleep is important to consolidate memories, and also really important the glymphatic system, which is the brain's lymphatic system, to get rid of toxins, and that only works at night.
The thing of it is, so your neurons, obviously, your brain is in a skull.
Yeah.
It's in a case, right?
Yeah.
And so there's limited access to things going in and out. So if you think of it as like living in a big city, like in a shoebox apartment in New York City, for example, right? How are you going to take out the trash? Okay, when your neurons, your brain cells are functioning, they should be functioning, right? So when they're functioning, what's happening as a result of that metabolism? They start to accumulate byproducts, metabolic byproducts, the trash, if you will, and that trash needs to be taken out. And if you're living in a shoebox apartment in New York City and you're starting to accumulate trash, guess what? Things are going to go bad. Okay,
Yeah.
your apartment's going to start smelling.
Right.
Things are going to start going haywire, if you will.
Yeah.
And so your brain needs to take out the trash every night, and the way that it takes out the trash is the glymphatic channels,
Yes.
right? So it literally, you need to sleep in order to bring down the pressure in your brain to allow those glymphatic channels to open up so that trash could go down the chute. And if you're not doing that, you're going to have trash building up in your brain, and it's going to lead to all sorts of dysfunction, including anxiety.
Yep.
Right.
Yeah. Anxiety. We know that disruptions in the glymphatic system can lead to accumulation of toxins like beta amyloid plaques
Yeah.
and tau tangles and things like that. And also, the glymphatic system is really important for distributing, cholesterol and lipids to your brain. So if that's disrupted, that's also a problem. And like apolipoprotein, people probably heard of that, associated with Alzheimer's. One of the things is, apolipoprotein is needed to also move, around toxins, including beta amyloid, and distribute lipids and cholesterol as well.
And lipids are incredibly important for brain health
Yeah.
because 60% of your brain is made out of lipids, fat.
Right.
And the most important one being omega 3s. Omega 3s have a big part in the structure and the overall function, indirectly relating to function
Yeah.
of the brain. So, incredibly important to have all these things going smoothly. Once things start getting interrupted, that's when problems happen.
Yeah. Absolutely. Like I said, we talk about neurodegenerative diseases, and one of the main things is because they have possibly right, like the association of like buildup of the plaques and tangles, and that they think is because of decreased clearance of that, and buildup of it. Of course, there's a genetic. If it's a dominant, like Alzheimer's early onset, usually it's a genetic predisposition to it. But again, most people, I think, if they change their diet, modify their diet, and get good sleep,
Yes.
and lifestyle changes, be it healthier. It's hard to do, especially the diet. I get it.
Yeah. Also, too, because I want to get back to nutrition for a second and touch on intermittent fasting, because we always hear about, people who do intermittent fasting, they feel like they have better mental clarity. How many times have you heard that? Oh, I have better mental clarity when I do intermittent fasting. And part of that gets to exactly what we just talked about with the brain. Essentially, it's replenishing its own neurons, right? When you do that. So, intermittent fasting, as well as exercise, both of them, they stimulate AMP kinase, which is an enzyme that basically it's going to affect the metabolism of the cell, to put it in a short way. And when you're stimulating or when you're doing intermittent fasting, it stimulates what's called mitophagy and autophagy, which basically is the cell's version of cleaning up itself. Mm-hmm. So when there's a big party, after all the people come over and they make trash here, trash there. It's a big mess, right? Now it's time to clean up the party. You can't go to sleep with everything just laying around like that.
Right.
I mean, in the metaphor, So, but basically, the point is the neurons, they need to clean up after the party and replenish itself, and that's what fasting does. That's also what exercise does.
Exactly, and we'll talk about astrocytes too. Those are the cells in the brain that actually help with repair and also help part of the lymphatic system as well.
Yeah,
and kind of regenerating, replenishing your CSF and clearing out the toxins.
Right.
So they also get affected, with poor metabolic health. I think it also connects a connection with the enteric nervous system as well.
Yeah,
and it's health based on that. So all these things, I think over years of like chronic poor metabolic health probably adds to just like a low grade pro-inflammatory state.
Oh, not think, it does. We actually have seen studies now where we can actually visualize this. So there's something new called a QMRI, a qualitative MRI, and they've actually seen in people with metabolic syndrome, they're actually able to see the increased grayness in certain areas of the brain, including the hypothalamus and I believe the hippocampus, where we store our long-term memory. So the bottom line is we can actually visualize now people with low grade, it's called chronic low grade inflammation in the brain in people with metabolic syndrome. So this now, because now it's like before you can't see it, but now we can actually see it.
Yeah, and then your body's in a state of stress also, right? You're stressed out, pro-inflammatory state, and then you have the neuroendocrine system also gets imbalanced. The hypothalamic pituitary adrenal axis gets affected, and you have a state of basically steroids, and that affects your limbic system, your amygdala. That's adds to people's anxiety and mood lability, dysregulation of your mood. We see this with people that are on chronic steroids, high dose steroids. Obviously, that association is clear.
Right.
So if you think of people that are on high steroids and how it leads to high states of anxiety, depression, mania, psychosis, emotional disturbances, and dysregulation, that happens at a low grade inflammatory state too, just probably less severe.
And that's the thing is we hardly ever talk about when we give someone steroids. Yeah. Oh yeah, they work great to fix the inflammation that you're having in the body, but they have a million side effects, right? And one of those is what you just mentioned, the mental side effects of those steroids.
Yes.
So definitely not to be underappreciated. So basically, to your point, so increased stress, whether that's from bills you have to pay, job, relationships, whatever it is.
Yeah.
This is going to add stress to your body and is also going to have a huge impact. So that's why it's so important to do things to, if we can, alleviate that stress.
Yeah, I mean, from an evolutionary standpoint, right? Stress, getting in a hyper anxious state was good. If you saw a lion, you want to be in a hyper aware state,
Right.
then you want to have a high sympathetic tone,
Right.
right? And you have like your norepinephrine and norepinephrine go surging, right? And that's good. It
Right.
shunts all the blood flow to your heart and your eyes and things to help you escape and run away or deal
Right.
with the problem. But that's meant to be, temporary,
Right.
right?
And also too, it's that happens with the anticipation that you're going to need to use those muscles in that fight or flight situation. So if
Right.
you're stimulating that pathway, but you're not doing those things, you're not
Exactly.
exercising, you're not moving something heavy or running or doing something that involves exertion.
Right.
It's kind of like, well, the body's tricked in a bad way.
Yeah. And the body, we're in a pro-inflammatory state. We're reacting as if we're seeing a lion. That's what happens when you're in like a state where you're stressed out and chronic inflammation. That's a signal that it's sending the brain to like act,
Yeah.
do something.
And what would you say would be the best ways to alleviate stress?
Yeah, always starting with lifestyle first and diet.
Yeah.
Start with that. Alleviating stress. I mean, it comes down
And
to
we'll get into exercise.
yeah,
Obviously, exercise has a big involvement in that. But in terms of non-exercise, I think a lot of it is we live in a society where we don't get out with nature often
yeah,
enough, and we don't have as much sense of community as we used to.
exactly.
We're a lot of us are just glued to our phones, and we're losing our personal human-to-human interactions.
Yeah,
Um, that's why if you can do things in a group with friends that are, especially if they're outdoors, whether it's
yeah,
hiking or just going for a walk or
and
something,
maybe get disconnected from social media
yeah, unplug
and
for a while.
yeah, because we live in a kind of a society where it's like everything is like crisis mode. Every election, everything. You turn on the TV, it's basically your blood pressure will go up.
Yeah,
Probably right.
yeah,
So everyone's in like the state of anxiety and it's such a polarized kind of climate these days. So I think that adds to our stress, and of course with kids, don't even get me started on kids and social media and how, and obviously the pandemic, how stressful that was. But yeah, having a sense of belonging, going out in nature, hiking, resetting your brain. We're disconnected from nature, and that's actually where we're supposed to be. We're surrounded by concrete and
yeah. I was just gonna say,
timelines and
yeah.
bills, right? So getting out,
So because
taking
most of the time that humans have been on this planet, we've
yeah,
not been in an office in a building, right? Most of
right,
our existence has been out with nature.
yeah.
I think that's basically where we're
It's
meant to
calming
be,
and
right?
soothing. It
Right.
is, pro serotonergic and GABAergic,
Yeah.
to have to be out in nature.
Yeah.
So that's one thing. Obviously, working on relationships and also being realistic about your life goals, work-life balance, right?
Yeah.
You could work 60 hours a week, and I get it, you have to pay bills, and most people probably are forced into those situations. But a lot of people do have some control. It's about what is worth it for
Right.
you.
And also too, if the longest study ever done, which is still ongoing from Harvard, right, started in the 1930s. They followed, generations of families over the years,
Right.
and what they found is that the people who live the longest, happiest lives are the ones who have the strongest connections, good relationships. So meaningful, real relationships with people. So
Exactly.
if you're lonely, that's not the good recipe to have.
Right.
You want to have really strong connections with friends, family, so forth.
Yeah, exactly. And also, so we talk about sleep, obviously, exercise, even if it's a little bit. Again, if you're mostly metabolically healthy, again, I understand people are saying, hey, what are we going to eat? Because we're making it sound like you have to go out to the woods and pick your fruits and vegetables. If you go to a farmer's market, and we'll talk about that stuff, real food that's
Right.
not been processed, not gone to a factory. You want to try to do that most of the time. You can have a cheat day or two. That's what we're trying to get at. I think a more realistic,
Right. Which
perspective.
actually gets to the point of there's a lot of benefit in cooking and also eating together
Yeah.
as a family, if possible. Obviously, it's not always possible,
Right.
but ideally, families that cook and eat together
Yep.
is really not something that should be underestimated.
Yeah. And the quality of the calories matters, right? It's not just like the old adage of calories in, calories out.
Right.
They did a study, right, with mice where they were given the same calories. One of them had water with aspartame, which is technically 0 calories, right? The other was just regular water, and the one with aspartame, they gained weight. They
Yeah.
were metabolically unhealthy. They had dyslipidemia and triglyceride disturbance. So yeah, they showed that even though they were technically both 0 calories.
Right. And also, I mean, if you're eating 2,000 calories of a highly processed diet
Right.
of Doritos, Oreos, soda, French fries, pizza
Right.
versus 2,000 calories of unprocessed food.
Yeah.
Whole intact grains, seeds,
Yeah.
nuts, vegetables, fruits.
And also being a prone, it's almost like a vicious cycle. Once you get
Right.
into a pro-inflammatory state, a chronic stressed out state, it makes you eat more
Right.
impulsively and eat stuff with that's unhealthy. Right.
That actually happened to me when I was working in the ICU during the pandemic. All I was seeing was COVID patients in the ICU.
Right.
That was a very stressful day every day, and then I would literally just eat out of stress or because I was tired or both. And so even if I was full, I could feel like my belly's out to here, and I'm just now all of a sudden I'm just eating just because I need a distraction. I was
Yeah.
looking for that dopamine hit to distract myself from the stress that I was going through, or because I was tired.
Yeah, most of the foods are that that have artificial this that to make it tastier. Yeah, they're basically hijacking your whole satiety system.
Yeah.
And basically it is a dopamine. It becomes sort of a reward pathway. Hijacking of that, and yeah, I mean that's why Doritos, like, people can't just eat a couple of chips. It's
You can't just have
or the
one.
batter,
Lay's.
right?
This is not sponsored by Lay's potato chips.
Right. Um, so yeah, that's a lot of it too. And again, it's
Mm.
foods that are pro-inflammatory, right? We're talking about things that are highly processed, even like some of the seed oils are processed. Those are pro-inflammatory in nature. You know, um, Obviously added sugar, high fructose corn syrup, all of these things. So it comes down to the less processed. Definitely, added sugar is not great.
Right. And then people become addicted, right? And
Yes.
they literally can't stop.
Yeah.
They can't stop eating all that.
Yeah, refined carbohydrates, added sugars, these things are addicting by nature. They kind of give you that instant hit, right? Sugar is like instant hit, and especially high fructose corn syrup.
Yeah.
Yes, I mean those things. If you understand it from almost like an addiction point of view, yeah, it makes sense. Right?
And really, I mean, it's easier said than done, of course, but there's a difference between eating for pleasure and eating for health. And so many of us, myself included, are guilty of eating for pleasure,
Right.
and it's hard to break that cycle.
Well, eat to live or live to eat. I mean,
Right.
also part of the joy of life is food, and but like you were saying, when it's a social gathering, getting together, you can have a nice healthy meal that people are part of and cooked. That's, I would say, the joy
Yeah.
part of life. Most of us are stress eating,
Yeah.
right?
Yeah.
So you actually, I think, if you just think of it as like, I'm eating to live,
Right.
and then once in a while you can live to eat.
Correct.
You can have those cheat days, or a Sunday football party. You had something fine. It's not the end of the
Right.
world. Your body will probably be able to handle it.
It's what you do most of the time,
That's what
right?
you do most of the time.
Right.
Yes.
Okay. So we're about a half hour in. This is the point where we'll start looking at questions. So if you guys have questions, fire away. Oh, before we get into questions though, I just want to say, so what if someone does everything, let's say perfect, right? Let's say they're doing every lifestyle factor they should be. They're exercising 150 minutes per week, moderate exercise. They're meditating. We didn't talk about that one, but they're mindfulness, meditation.
Yeah.
They're eating great, unprocessed food. They're hiking out in nature. They're doing all these lifestyle things that they should be doing, right? But they still have anxiety. Well, even if they do have anxiety, they should be doing these anyway because that's going to help, right?
Yeah.
But let's just say they're doing all these things and they still have anxiety. What do you think is the solution in general? I know I'm being very general here, but in that sense, in that situation, what do you think is the best approach?
Yeah, it's a great question. So everyone, of course, like you said, easier said than done. If someone's following, a good diet, they don't have any medical, issues, endocrine issues like thyroid or things like that that can contribute to anxiety, of course. So as long as they're,
assuming they don't have a medical issue like a thyroid or adrenal gland issue.
Exactly. Right. As long as they don't have any of that, then yeah, you get to the bottom of where is the anxiety coming from? Like, what is the source of the anxiety? Again, good history taking, and if it's again, if someone presents like that, I've yet to see someone that has like persistent anxiety. Usually their anxiety is related to something like a life situation, which is kind of normal. But yes, it could also be that they actually have, a possible, genetic reasons for it.
Mm-hmm. Or something traumatic in
childhood, or again, that would be more like a true anxiety state then, right? Now we're talking about there's no false anxiety from metabolically poor health. This is actually a psychological
in other words,
phenomenon, a mental phenomenon.
It's kind of like what's their it's the driving force.
Yeah, and they could be, they have like we call it catastrophic thinking the worst thing's going to happen, and that's where CBT and things like that come into the picture. And then, of course, yeah, I mean, there is a genetic, polygenic inheritance is really most psychiatric, issues, including anxiety, because anxiety is such a broad, falls under so many psychiatric, diagnoses that we can't, it's hard to classify it just as like anxiety. It's a spectrum,
Okay.
and the causes are, again, multifactorial in a lot of ways. What I would say is the metabolic is a huge part of it,
Right.
and it's also how you deal with stress. So if you're metabolically healthy, you're going to be better equipped to deal with stressors in life, right? So someone
Yeah.
that's metabolically healthy and doing sleep hygiene, all that, like I said, I've yet to meet someone that has really severe anxiety that's persistent for no reason if they're completely healthy and following all of that. Again, like I said, people have anxieties, have phobias, OCD, different type PTSD, the other anxiety spectrum disorders and symptoms. Then yes, that you get into the backdrop of what it is. Again, we talked about ADHD last time. You're anxious because you can't focus.
Right.
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 That's part of it. Is that.
Right.
So anxiety has very a myriad of causes and presentations as well, and it could be a sign of maybe things to come. Like a lot of times we see kids that have severe anxiety or young adults, and maybe it's bipolar that we don't know yet, and it's kind of brewing.
Yeah.
So there can be any number of things, and we haven't talked about drugs and alcohol, right? Like we
Right.
haven't talked about that. That's a huge reason for people's anxiety.
And that's a huge reason why people
Yes.
can't break these cycles,
Yeah.
because they either it's the drug or the alcohol is their crutch, or they're addicted and they can't
Right.
break that cycle in order to do the things that they should be doing, like
Right.
like the lifestyle choices.
It changes your autonomic tone, right? Usually when you do drugs, alcohol, yes, kind of like changes your sympathetic tone. And just, in that situation, it can take sometimes weeks, months, even a year of like being off of drugs if someone's been using, drugs like every day.
Yes.
And then it takes them a while to get emotionally kind of like well regulated again.
And this is why we're so reluctant to prescribe people drugs in the first place, is because we know once you go down
Yeah.
this avenue,
Yep.
it's probably in the long term going to be worse off.
Yeah, I mean,
But
right.
sometimes they're absolutely needed in that situation. In desperate times, sometimes we have to prescribe things that we don't necessarily want to prescribe.
Yeah, absolutely. A common example is sleep aids,
Right.
Ambien and all kinds of sleep aids, which might knock you out, but it's not. You're not getting the healthy sleep.
You're not getting that
You're
quality.
not getting the quality sleep that you need. All those stages to consolidate memories, and again, your lymphatic system and all of those things. So yes, you're getting sleep technically,
and you might feel like you're getting quality sleep.
You might,
but
feel
the
like,
reality
hey,
is you probably are not if you're on these medications.
No, long term, like it's not good to be on any of these like sedative hypnotics or things like that, because they do disrupt the architecture of your sleep.
And it's so easy for us to fall in this trap of, well, just give me the magic pill to take care of my problems.
And it's obstructive sleep apnea. That's another common one, right?
Right.
Again, your sleep is affected by something external that could be fixed. So true insomnia is something that is much rarer than people think.
Right.
Right.
Because if you're doing all these lifestyle factors to the T, you probably realize that you don't have true insomnia for most people.
For most people, yeah. Right. For most people. So those are just some of the things, I think to like kind of like touch on lifestyle wise.
And you also mentioned sleep apnea, which I'm glad you brought up, because lots of times, whether it's alcohol or it's benzodiazepines like Xanax or whatever, what ends up happening is if you take, or Ambien, what ends up happening is your muscles of the throat, they end up relaxing, and they become more relaxed when you're taking these things. And that's why especially if you're lying on your back, people tend to snore more. But also, if you're someone who's prone to sleep apnea, you're going to be more prone if you're taking these drugs, because those muscles are relaxing, closing the airway. And so if you have sleep apnea already, it's only going to be worse if you're taking these medications. And of course, when sleep apnea is worse, guess what happens? The cycle just continues to get worse and worse, because that means you're not going to get as high of a quality sleep. Your sleep is constantly being interrupted from these apneic episodes. And so the problem is only being exacerbated.
And again, your body then goes into a stress state.
Yeah, when you stop breathing during a sleep apnea episode, what happens? Your brain, there's a surge of catecholamine, so the adrenaline. There's a surge of that adrenaline, and then your heart rate goes faster, your heart pumps stronger, your blood pressure goes up. That's the stress response. And then the more often your body's doing this, let's say every 30 seconds or so, or whatever it is, depending on how severe the sleep apnea is, the more often that happens, the worse it is for your body. And that's why a lot of people with sleep apnea end up having cardiac arrest, or they'll die in their sleep, where their heart just simply can't handle it. And so it's definitely not to be ignored. Sleep apnea is a very serious condition.
Yeah. So sleep, I think, emphasizing that, absolutely.
Yeah.
And I think some of the apps now, like the whatever Apple Watches, they're good for that, right?
Well, that's a whole topic in
Okay,
itself because what good is this? First of all, how accurate are these?
true.
How accurate is the Aura Ring? How accurate are these apps? And even if they are accurate, what is the information that it's telling you? What are you going to do with that information? How is it going to change? What
Right.
what is the behavior that you're going to change to affect that?
Well, it's supposed to be to help people
Correct, but how?
change. But you're right, absolutely. Like
Right,
doing all these other, lifestyle modifications,
right.
like sleep hygiene and things of
Now
that
maybe
nature.
maybe it can be helpful in certain situations. I guess it depends because let's say it's showing that your heart rate is going very fast and maybe it's kind of cluing you in that maybe you have sleep apnea. Maybe you should go for a sleep study
Yeah,
in order to make that diagnosis.
yeah,
So it can be helpful. I'm just saying, one, is it how accurate is it, and two, because these haven't been validated with studies, right? Like
right.
large randomized control trials. Have you seen a large randomized control trial for the Aura Ring? And what are you looking at? How
Yeah,
accurate is it, and how are you able to implement that change if you do get accurate information?
right. Okay.
So,
Yeah. Is there questions you want?
all right, let's look at Peter says Peter Parker's puberty says, I have sleep apnea. I've been in CPAP machines since 2009. Glad you're taking or sticking with the treatment. That's good. Melatonin should be the first line of therapy in insomnia management since we all naturally have this. The pineal gland is automatically secrete. I think she's saying
Yeah.
secreting it
So
the
I
moment the sky turns dark at
Yep.
night.
So I
That's a
want
good
to.
good
That's a good
point.
point. Good
Yeah.
point. And melatonin, actually, thanks for bringing that up. Yes, melatonin is super important, and you're right. The pineal gland secretes this, and it accumulates as soon as like this light changes and is getting dark. But if you waste those hours by not going to sleep, not turning the lights, keeping the lights, everything dark, the lights off, especially blue light, um, then you're basically gonna waste that melatonin.
Yeah.
It's not like, oh, you keep it for like, and then when you want to go to sleep, it starts working. You waste it's really good for that time of the day is where it
Yeah.
starts building up. So people's, rhythm and cycles kind of go off when they stay up and forcibly like are watching TV, or maybe because of work they have to stay up or for whatever reason. And then that's basically it. So yeah, taking melatonin is probably the first line I would say after doing sleep hygiene and maybe chamomile tea or some other things that to help like kind of like relax you. But yes, melatonin absolutely, because it's natural.
Yeah.
As long as you have to for the melatonin to work, you also have to do sleep hygiene. That's the thing.
And then Kimberly mentions that melatonin doesn't work for her, and I think that's if you ask 100 people in a room, probably 50
Yeah.
will say it does, and the other 50 say it doesn't.
Again, what else are you doing lifestyle wise?
There's so many different
Yes,
factors.
melatonin again. Like, I get it. It didn't work for me when I was doing overnight shifts. Of course, it
Right.
didn't work for me when I was doing overnight
And
shifts.
then and then we can skip past the anecdotal stuff. It worked for me. It didn't work. But
Yeah.
what did the studies show? What do the randomized control studies
Yeah.
show? And it's not really conclusive one way or another. It's not hard evidence that shows that it does or doesn't work.
Mm-hmm.
I think we have a lot of mixed studies out there that aren't very conclusive on that. So
Yeah, sleep is terribly underrated and underappreciated. Absolutely.
okay, Jennifer Gregg says I have treatment-resistant anxiety. My therapist of 4 years recommended ketamine therapy. What do you think about ketamine?
Wow, that's interesting. I know ketamine is approved and used for treatment-resistant depression, major depressive disorder with suicidal thoughts. Um, for anxiety, I would have to look into, some more of the research. I
But
don't
also
think it
too,
would be.
anxiety and depression
Yeah,
are have a lot of overlap.
they have a lot of overlap. And
Right.
again, coming from a metabolic perspective, I would first address any metabolic issues, right? What is the reason and cause of the anxiety? So going to something like ketamine, which and sidestepping maybe lifestyle and other issues, addressing those and trying other medications or options for anxiety. Again, I don't know too much about ketamine for anxiety. I'm sure they're still doing the research on it, what it can help. But like I said, I know it's for depression and suicidal thoughts, especially treatment-resistant depression. I know it's been shown to be pretty beneficial.
Right. And leading to that, we could also talk about psilocybin, right?
Yes.
So basically, not too long ago, within the last couple of months, there was a big article published in New England Journal of Medicine
Yeah.
that was looking at psilocybin for treatment of depression, a single dose, right?
Yep.
And now it's not anxiety per se, but again, depression, anxiety, lots of overlap
helping
there.
with PTSD, depression, anxiety states. It is serotonergic in its effect. right? So that's one of the reasons possibly, and also it's about, and those are also, by the way, in a controlled setting with a therapist guidance.
Right.
Let me just put that out there. It's not
Yeah.
microdosing and partying on the strip.
Yeah.
It's microdosing and
Right.
in a guided session where you can, sometimes it helps people to get more in touch with their emotional self and be able to verbalize and help them process, whether it's trauma or any life event. So that kind of helps them become more social and in touch with their own, emotions and be able to express it. I think that
So like
kind
a
of,
self-awareness when they once they
yeah,
process their
exactly.
past.
Yeah, and it helps them, kind of get to an existential state, if you want to call it that. And working with the therapist, they can make, significant inroads.
Right.
And so that's kind of what I think the
And what they showed in that study, it
shows.
required the higher dose. So it was a single dose, but it was the higher dose that was shown to be effective.
Yeah,
I don't remember what that dose was, but
and I think they're using that also for a possible as an avenue of treatment for certain addictions and things like that as well.
yeah.
So that's still, like I said, it's still its early stages of where it's headed, but that is looking somewhat promising
Yeah.
in certain situations.
Okay, you want to handle a question?
Yeah. So my anxiety slash depression is caused by chronic PTSD. This is Jennifer's question. Yeah, Jennifer, you're right. Like I said, once you kind of rule out any secondary or false, I would say, like, false anxiety, if you want to use that term, because that's anxiety that's related. That's I would call downstream. The problem really is we can throw benzos, we can throw medications, but they're just a symptomatic treatment, right? That, like I said, if you're metabolically unhealthy, the real treatment is to kind of get metabolically healthy, change your lifestyle, things like that. That'll
Either
probably,
either way, you want to do all the lifestyle factors
yeah,
that you should be doing. You want
right,
to eat as healthy as possible. You want to
mm,
exercise. Possibly intermittent fasting,
right,
and meditation or stress reduction. So
exactly.
either way, you want to be doing all these things regardless.
And it just sounds like a lot. Even if you start by doing one or two things first, it could be just diet. It could be 3 days a week that you're like, hey, I'm just going to eat whole, real food. Starting simple, you'll start to notice a change. Most people do, when
Yeah.
it talks about diet. And again, most doctors don't spend this much time talking about nutrition. So they are, happy to kind of give medications to treat symptoms. Again, if it's downstream symptoms, like this is a result of your body telling you something's not right, then I would address that. If it's because of trauma, then that's a different thing. Then I would say, yes, that's where it's more of the true anxiety. The primary source is an possibly unresolved psychological conflict or a repressed memory, or attempt to, repress a memory that is, really terrifying. So yes, that is where, medications will, help in certain cases, and therapy.
Do you remember when you told me the story of that patient with hysteria?
Yeah.
I mean, I think this just
Right.
goes to show the impact of what you're just saying. I mean, I think it's a perfect example.
Right. I think it's now called idiopathic functional neurologic disorder or something like that, conversion disorder, as it was
So
called
so what
before.
was her symptom? What was her issue?
Uh,
Was
it was like
she
it was a paralysis from what I remember, but it
so she
had
was
she
paralyzed?
was
Okay, how old
paralyzed.
was this woman?
She was in her late 40s at this point
Okay, so a
when she
40
was coming to
something
the
year
clinic.
old woman who's all of a
Yeah,
sudden paralyzed.
she had paralysis and also some distribution of what's it called, like the stocking glove distribution.
Okay, so the nerves were
Yeah,
basically the
anesthesia, like a stocking
so
glove,
she
like
couldn't feel part of
it
her
didn't
hand.
follow the distribution of the actual nerves, and that's one of the
Oh,
signs of like,
so
okay,
she
this,
saw so she saw a neurologist, and neurologist said, "Well, this where you lack sensation doesn't
right,
follow the nerve pattern,
right.
so that's how I know it's not an actual physical nerve issue."
Well, it's a diagnosis of exclusion. It's rare, so I just want to put that out there. But it's a great example of the power of the mind. She was traumatized repeatedly, and really the symptoms were a
So she
manifestation
was
of this
traumatized as a child.
as a child.
Okay, can you
A lot
tell
of
the whole story?
There was a lot of sexual trauma,
Okay,
in the family, and the double trauma. Once she was, traumatized, also the second trauma is no one believed her, right? And that happens also. Then you become, it's a rejection. So she went through a lot of trauma. I don't want to go into the exact details, but it was pretty heavy and pretty chronic. And yeah, she started developing these symptoms, but she also didn't know why. Right? She wasn't consciously aware. It's not like she's feigning these symptoms or anything like that.
right.
And neither did anyone else for many years. And there was no actual like medical explanation.
So she saw all these doctors. They said
Yes,
there's nothing physically wrong with her,
there's nothing physically wrong.
even though she's like I'm paralyzed.
Yes,
Okay,
yes, yes,
okay. So then they come to you.
yeah. She's coming to outpatient psychiatric clinic because anxiety was one of her symptoms. Yes, ultimately what it came down to was she had a lot of unresolved conflict that was really heavy, emotionally laden, memories, and just like I said, she'd never talked to a therapist. She never processed what she went through.
This is mind blowing to me because I remember med school learning about these things,
Mm.
and it almost seems like, is this real? Like, is someone really paralyzed, and then we can
Yeah.
send them to a psychiatrist to unparalyze them, if you will? It's almost hard to believe, right? I mean, I've never seen a patient like this, but this is just incredible. And what did you do next?
Well, so again, these cases are rare. Yes,
They're they're very
it's
rare,
hard to
but
believe.
but
I didn't
they're
really
they're
believe it
very
either
they're
going
very
into
they're
med
very
school.
rare, but
Yeah,
it also shows the impact,
it shows the
how
power of the
how
mind.
how crippling
Yeah.
anxiety can be,
Well,
right?
that's an extreme case. I would say we all fall in a spectrum, and
Right.
to certain degrees, varying degrees. It's not like black and white. Like you have severe PTSD, and you don't.
Right.
Yes, it's true. Not everyone exposed to the same trauma is going to develop PTSD, and a lot of that has to do with, again, it's multifactorial.
Genetics,
Genetics,
epigenetics.
the priming of, like, how much you can handle stress or not. Epigenetics, what you were exposed to in utero, and how that affects, like, your ability to respond to stress,
Yeah.
and genes to get.
So getting back to this patient.
Getting back to the patient.
Yeah.
Sorry, going off track. Getting back to the patient. This is like a perfect example of the fact this was an extreme case of, again, psychological complex that was going on mentally that she had not resolved. Again, I'm not an expert. I'm not like a psychoanalyst. I had to refer her to
Right.
an actual psychoanalyst.
So she did CBT,
She underwent psychoanalysis.
psychoanalysis.
Yeah,
Okay.
and kind of like going through the trauma, which was really difficult.
Right.
And rehashing those memories was traumatizing, and her symptoms did get worse. That was a physical manifestation of mental, emotional content, which was producing a lot of anxiety.
So she had to go
You
through
know,
hell to get to heaven, right?
exactly, but that was all being repressed from her conscious awareness for
Right.
the longest time, or at least like unable to process it.
And that's exactly what your point
Yeah.
was to when we're talking about psilocybin, is
Mhm.
allowing them to process
Yeah,
what happened, right?
she did get better, actually.
Right.
Yeah, she got better after quite a bit of therapy. She was able to eventually kind of move past it.
Yeah.
Was walking around. It was kind of unbelievable.
Right.
Again, that was an extreme, and that's a rare case.
Right.
But it's I've seen other less extreme cases of it, and I'm pretty sure on almost a daily level, if we're in denial about certain conflicts, or like, oh, we just swept that under the rug, nothing really truly gets swept under the rug that means something to
Right.
you.
Because prescribing her an SSRI, like prescribing her Lexapro and Xanax,
We
was
did all
not was
that.
not the solution,
Was not the
was
solution.
not the solution, because it's not getting to the root cause of the
It's not
problem.
getting the root cause, exactly. Yeah, she was on antidepressants, benzos for a long time.
Yeah.
And I'm not sure, like, like the follow up, like what happened, and if she still needed that or not. But that, that never helped cure her issue or solve her
It
problem.
wasn't getting to the root
It
cause
wasn't
of the
getting to the
problem.
root cause of the problem.
Right. And that actually, so, and the same can be said for all of our metabolic illnesses, whether it's high blood pressure, fatty liver disease, insulin resistance, and type 2 diabetes. All these things are caused by eating unprocessed food, or eating too much unprocessed food.
Right.
I'm sorry, processed food. I got that backwards. Okay, so
It's Sunday, so today
the,
we're eating
the
processed.
bottom line is nutrition absolutely is the driver, the root cause of the problem of chronic metabolic diseases.
Yeah, I would say majority of people that report anxiety, again, it's lifestyle and diet would probably mitigate their anxiety.
Yeah.
And therapy if they want to talk
Yeah.
about it. Yes, if you need medications because it's really severe, like, again, PTSD, panic attacks, things like that. Yeah, you need symptomatic treatment just to get through, changes, working through the changes.
Yeah.
And change your diet. It's going to take time.
Yeah,
right?
Jennifer says, I've been in CBT therapy for 5 years now. I was medicine resistant until about 6 years ago. I'm 38 now, still suffer with anxiety. It's not just food, lifestyle. Yeah, so that's the thing, is like we talked about earlier, 10% of it um, is actually what's, really the brain it's originating in, and it will, everything can be improved with lifestyle factors, but not everything will just totally disappear in some people.
Yeah.
Um,
I see a question here about THC. Do THC derivatives work? Can you get
edibles.
legally edibles? That's a good question. I have patients come in and say that CBD helps them with anxiety and things of that nature. Again, is it symptomatic treatment? Right. That's what I would get at. just like anything else, yes, it's helping with the anxiety, but the question is, where is the anxiety coming from? What is the source of the anxiety? And again, the CBD is probably less harmful than some of the other stuff that people take for anxiety. But it has its pitfalls also. Children smoking marijuana has been linked to loss of IQ points, so it does affect your memory formation and cognition negatively. So that's there. So I wouldn't recommend it.
Yeah.
Especially not children and young adults.
Especially because
Yeah,
the brain is very plastic.
yeah,
It's the younger you are, the more plastic it is,
yeah, exactly.
and
So
it really doesn't mold. It never molds into its final form, but
yeah,
if you will, its final form until like what age 25, somewhere on there.
yeah, right. About 25, 26. It's always the brain's always growing and developing. It's plastic way
Right.
longer than we thought. But yeah, the majority of it, it can probably till about 24 or 25.
Yeah.
So those are sensitive times. So I wouldn't recommend doing it all the time.
That's why it's way easier. When the brain is so young and plastic, that's why
Yeah.
it's easier for kids to learn 5 languages.
Mhm.
Imagine I'm trying to learn 5 languages right now.
Right.
There's no way that
And
I'm
also, there's amotivational
right.
syndrome. Kids get they're smoking pot all the time and all that kind of stuff, and then they don't want to do anything. They lose the motivation,
Right.
and they're staying in the room and just playing games. So that also is has to be addressed. It's more complicated than just that. So I know it doesn't really answer too much of the question, but I have heard people say that they take CBD, and again, I just give them the spiel usually.
Yeah. It's also tough when there aren't really good studies to definitively say one way or another. We
Yes.
have big randomized controlled trials, and then you have another study that validates those results.
Right.
So it's really hard to say, until you have those kind of results.
Exactly.
And
Yeah.
a lot of it is people are, give anecdotal results. Oh, well, I tried this and it worked for me, or I tried this and it didn't work for me. So it's
Yeah.
sometimes it's really hard to tell.
Yeah.
So yes, this will be posted later. So any other questions? Susan says box breathing is very helpful. Yeah, I mean, focusing on meditation, mindfulness, and breathing techniques is very helpful to help with anxiety. That's for sure. Okay, well, I don't see any other questions, but want to thank you guys for being here. I apologize that the audio wasn't up to par. Next time, I'm gonna get that straightened out. And I want to thank you again for joining us on this Sunday afternoon. Thank you for being here, Dr. Hizbay Ali,
Thank you, Mike, for
and
having me.
providing your mental health expertise. And
I tried.
so again, thank you everyone, and have a great rest of your day.
Yep. Thank you, guys. Take care. See you next time.